Welcome you back. A big-time data breach of North Shore Health Systems forcing the hospital to warn patients about potential cybercrimes.
Well, now one expert thinks that other hospitals could be next. While hospitals have been focused on the COVID pandemic, in at least one case, hackers focused on them. North Shore Hospital reports a data breach that affected an estimated 348,000 people. According to North Shore, the information taken included full names, date of birth, addresses, phone numbers, emails, admission and discharge dates, and the name of the physician.
Personal health records are so full of personal information.
Rich Stuppy isn't connected to North Shore or the investigation of the breach, but he is one of the chief officers at Count, specializing in data breach and fraud control. He says right now, hospitals in general have a lot on their plate.
One of the things that will happen is because many hospitals are undergoing particularly troubling business circumstances right now, they are maybe limiting some non-essential staff, and as fraudsters target them, they find commonalities in the systems that these different types of businesses use. And once they knock down one, they move on to the next one, next one, getting smarter and sharper at every one that they go to.
In this case, North Shore confirms that Social Security numbers weren't accessed and that they moved quickly to minimize any problems. Quote, this incident was not a breach of North Shore's internal systems. No patient medical records were accessed. But targeting hospitals could become a dangerous trend. Just last week, Northwestern Memorial Hospital notified 56,000 patients that personal records were accessed. Stuppy thinks others could follow as hackers develop a technique.
So once they learn how to exploit it, it's copy and paste. The businesses that are breached are victims as well. So we should know that they're trying hard to keep from being breached, but it's a very difficult challenge.
It is a tough one. Well, North Shore also tells me that based on the data involved, there is low risk of harm to the people affected. They are notifying everyone impacted and also reminding people to regularly monitor personal accounts for any suspicious activity.
Always good.